Welcome to Startup Health TV. I'm Logan Plaster. What if a wearable on your wrist could understand your movements throughout the day and predict health problems before they happen? That's the concept behind CarePredict, the startup that was founded by my guest today, Satish Mova. Mova and his team are using their award-winning wearable that they've designed to not only keep seniors safe, but to give families peace of mind about their aging relatives when they can't be right there next to them. They've also found that their technology can be used for incredibly precise COVID-19 contact tracing. By understanding exactly who has been in proximity of someone who's infected, they've been able to reduce the number of isolations in seniors by upwards of 80%. We'll get into all that as well as news of their recent fundraise. Stick around.
Crazy.
All right, Satish Mova, CEO and founder of CarePredict. Thank you so much for joining me today on Startup Health TV.
It's wonderful to be back here again, Logan, and really looking forward to speaking with you today.
So we've had you on the show before, and we know you've created this really cool, unique wearable that's worn by seniors. Let's see if I get this correct, that can really predict health issues before they happen, things like falls, but way more than falls, sort of deeper health issues by understanding the data of how someone behaves. So to start the interview off, I want you to just sort of give us a snapshot of where your wearable stands today, September 2021.
Yeah, we are still pretty much the leader in tracking activity and behavior signals using these wearable devices to find precursors to declines in health. And we've kept expanding on that. We initially started out being able to predict urinary tract infections. We've then gone on to predicting the probability of a fall, predicting the probability of a depression, all by looking at activity and behavior signals. And it's been known for millennia that activity and behavior signals always precede health declines, because when we all used to live together under the same roof, that's what we used to look at each other and decide something is going wrong with mom, we need to dive in. And the product has only grown since the last time we spoke. Now we are at the point of being able to track additional things such as metabolic equivalent task scores, ranging scores, mobility scores, and a lot of these are showing up as precursors to increasing frailty in seniors. So we're very, very excited about the next steps.
Remind me, because I think some of this is just really fascinating, how some basic behaviors that we might overlook actually end up, when you aggregate the data, pointing towards things like urinary tract infection or depression.
Yeah, so depression is a great example for that. So it's been known forever that somebody heading into depression will have signs and symptoms of self-neglect. So people no longer care about their own appearance or how they look or what they're doing. So we track those kind of activity and behavior signals that typically you would have relied on a human observer to catch. So for example, somebody heading into depression will stop bathing, will stop grooming, no longer brush their hair. They will have inversion of sleep. So they sleep during the day and stay up during the night. They may have drastic changes in their meal patterns. Either they overeat or they undereat. And they stay away from bright lights and sunlight. They stay away from other people. Every one of those things I just mentioned, our product can autonomously track without any self-reporting by the senior or need for any other human observer. That level of instrumentation of the senior is amazing and unprecedented, because as we all know, aging in America today and pretty much in the developed world is a lonely experience for most people. They tend to be aging alone, maybe themselves and their spouse. They're not really socially interacting that much. And they really don't have family coming and visiting all day long or staying there and seeing them all the time. So you really have no visibility on how a person is aging in between those medical encounters. And we are shining a light on that with our product now. Now you really know how somebody's aging.
You touched on this a little bit, but a viewer might be thinking, why not just get an Apple Watch? I'm sure there's an app that tracks these different things, or if there's not one today, there will be tomorrow. How is the wearable you developed different from that?
Yeah, that's a great question. We get that question a lot from investors, especially who are just looking at the fact that I use a wearable and Apple has a wearable. But really, it's a combination of sensors we put into our device and the kind of algorithms we've invented and created that are so unique. So our device goes on the wrist of the dominant arm, so it can actually track the gestures of the dominant arm. Is that a fork being lifted to the mouth? It knows real-time location indoors, like that, along with the type of room. Are you in the bedroom, the bathroom, the kitchen? And the suite of sensors we have is so different than any other commercial off-the-shelf wearable that's out there, that we have the ability to track these different signals like bathing and stuff that Apple cannot. And the bigger issue is that, you know, Apple Watch cannot really have a third-party app on it running that can track the signals we track, because Apple doesn't allow that level of hardware access to track sensors at that level of granularity we need. So this is a purpose-built wearable with exactly tailored for use just by a senior. No fiddly little crown, no little screen to fiddle with, and it's really just put it on. You don't have to worry about it, and the senior doesn't need to interact with the wearable.
Speaking of granular data, I think the last time that we checked in with CarePredict, you talked about how the wearable was able to be used with new software to actually help with COVID contact tracing, that it was actually really pivotal to sort of geolocating where an outbreak might have occurred. So tell me kind of how that project, which was obviously sparked by COVID, how that kind of played out and where it stands now.
Yeah, absolutely. So mid last year, you know, we jumped into this whole COVID thing because we have this very precise indoor location tracking built into our platform. And this kind of location, the kind of location tracking we use is not radio frequency based like Apple or Google were trying to do with Bluetooth, but instead is based on a different proprietary light beam technology that takes into account things like closed doors and walls. So when we started looking at our data, we started getting these insights about, we know exactly who's in the room, which room, and we can actually say, even though two people might be in adjacent rooms, they're really not in contact because there's a wall in between them.
Interesting.
So we took all that into account, and we have ultra precise location tracking, and we spun up a product called CarePredict Pinpoint in a matter of a couple of weeks. And we actually launched it into all of our customers. And not only did we do that, but we also did the world's first ever modeling study on how digital contact tracing can help or hinder the spread of COVID. And this is a peer-reviewed published article that you can get from the National Library of Medicine. And what we showed was that if you had an automated digital contact tracing solution like CarePredict Pinpoint, you would have 53% fewer cases of COVID. You would be able to isolate 66% fewer people, and you'd have, you know, about 6% fewer fatalities. Wow. Just because you're catching, you know, the propagation of that infection so quickly, because you can bring up an infected person, find all the contacts who were around them, figure out exactly what was going, who to go isolate. Now, that's what we did in 2020 during the height of the COVID. Now, during the later part of the year, as customers started using our product, they came up with some really amazing metrics. We had predicted 66% fewer isolation. They were actually seeing about 83 to 86% fewer isolations. Wow. That is amazing, because if you go into a nursing home or a senior living facility, previously what they were doing, one case of COVID, they'd lock down the entire facility, lock up all the residents in their room, and give them just food and just, you know, just totally socially isolated. With our product, they were actually figuring out who are the 4 or 5 people that need to be isolated, and only those need to be locked down, not the rest of the facility. So it's been tremendous seeing that, because a lot of the deaths in these facilities were related more to social isolation and lack of interaction and all these, rather than direct primary effects of COVID. So we're really, really happy about this.
How has the market responded to that product? Has that become a bigger piece of kind of what you're rolling out versus the initial CarePredict wearable product? And where do you see that going in the next year or two?
Yeah, absolutely. So CarePredict Pinpoint, like everything else we do, is part and parcel of our base product. So we don't charge anything extra for anyone. But the results I just spoke about have really caught the industry's attention, to the point now we have this avalanche of inbound sales, essentially, of all these facilities throughout the United States, not just the United States, but Canada, Latin America, and Asia as well, deploying our product and asking for our product, even in markets we haven't even entered yet. And I think the most significant aspect of how the industry is viewing us just happened last week. We were awarded the Argentum Best of the Best award for CarePredict Pinpoint. Argentum is the largest trade body for senior living facilities in the United States. And for them to give us their highest honor of that piece of technology shows you how the industry is thinking about us.
Very interesting. I have to ask, because you mentioned the sort of global markets, are you noticing any specific trends in where you're seeing interest outside the United States?
Yeah, definitely. I mean, it's the aging, it's primarily the developed aging nations that we're seeing a lot of interest from: South Korea, Japan. We've obviously been very hindered that we cannot go there and have boots on the ground and actually, sell the product. We had a lot of momentum going into 2020, but because of COVID, it kind of backed down a little bit. But now it started spinning up again. So the most recent countries we are entering into is in Latin America and South America, where where these very affluent senior group living facilities are looking for products like ours to reassure their clientele and their families that they will be well taken care of, even in the age of the pandemic.
Yeah. In general, where do you feel like the senior care industry is right now in terms of its adoption, its willingness to adopt innovative technologies?
Oh, that's a terrific question, Logan. I mean, if there's one bright side to this whole pandemic, it's really shown senior group living facilities, home care, and generally everything in the aging world. You really need to deploy technology now that keeps track of individuals, that knows exactly what's happening with them. You can no longer rely on things like, people self-reporting or occasional human observation and intervention to try and figure out what's going on. It's really brought to the fore that you need technology, and people are no longer shy about wearing a wearable or any of that. All those barriers that we used to think about are no longer there. And that's coming through in spades for us.
So you've been busy over the last few months. I'm not sure how long, but you've been raising a round. So I want to talk about kind of where that stands and really kind of what would I think it's a Series B. Is that what you're in? What would a Series B enable you to do?
Yeah, so we earlier this year, we did a smaller bridge to get us to the Series B later in the year. We knew that because of COVID and a lot of things going on, it wasn't the right time to raise money in the best interest of all of our existing shareholders. So we raised a very nice bridge, a substantial bridge, and that allowed us to defer our Series B to now, fourth quarter 2021. And our Series B is off to a roaring start right now, with lots of med tech and life science investors coming to the table, as well as corporate VCs of large corporate VC arms of large healthcare systems as well. And where we are really focusing for our next steps is into care management. We are going more and more into care management, into Medicare Advantage type markets, and our Series B is really opening the doors to that. Because one of the things that the entire aging and health industry has noticed is data like ours of activity and behavior signals are much more important than just physiological measurements and remote patient monitoring. So they're looking and saying, this is the kind of technology you need, whether it's a medical home, hospital at home, or any one of those buzzwords people are talking about, where primary care is coming straight to the home to take care of an individual. You need technologies like ours to surface these signals. And so we are going more into the care management. We've started working with United Health Group's Optum Group to build out our go-to-market strategy for Medicare Advantage. And we're launching into Medicare Advantage as well as part of the care management process.
That is really fascinating. You mentioned how with senior living facilities, COVID had this silver lining of making them realize that technology like this isn't a nice to have anymore. It's a must have. We need to have this data. There are real costs to social isolation. and not taking this seriously. So I want to give you a chance to sort of like dreamcast out a little bit and sort of say, if this really scales up the way that you envision, and we start to get these massive amounts of data and just an incredibly more connected health environment for the patient, what do you see as some of the ancillary benefits? Once you're connected, you understand the patient better, and you start thinking about population health in these ways. What are some of the other things we'll gain from that?
Yeah, I think the very first step is the fact that you have become a connected human.
Mm.
That I think happened to all of us as human beings as we age going forward. Whether we are wearing an Apple wearable by choice today, or whether we are going to be wearing a CarePredict Tempo wearable in the future because it's required by your insurance carrier or the health system or what have you, so that they can better take care of you. And the only way to really address aging, and aging is this gigantic iceberg nobody's paying attention to that's out there. No, a fifth of the planet is going to be over the age of 65, 70 in a couple of decades. Yeah. And we don't have the financial resources to take care of the aging. We don't have the human caregivers to take care of the aging. We have to deploy technology. And the way to deploy technology intelligently in this is to be able to instrument everyone, but direct that care and those resources to those who need it the most. And the only way you can figure that out is to have everyone generating these activity behavior signals so you know who needs the help.
Yeah.
And I think that is a superset of everything we've done so far, whether it's a hospital at home or primary care coming to the home, or population health or disease management. The biggest overarching thing is going to be you are going to respond and react to activity behavior signals or other signals being surfaced by a patient, no matter what care setting they are in, at home, in a senior group living facility, or what have you, and be able to direct the resources in a very precise, pinpoint way to that person to address that problem. That is the future of healthcare.
Well, you're at a very exciting point in a fascinating and a problem that seemed intractable in the past, but really making amazing progress. So I am excited to see what you're going to do next. With such a big issue, collaboration is key. And so I want you to get an opportunity to sort of say, who are you hoping to partner with? And it starts with the consumer. Let's say that someone is listening to this and they say, I want CarePredict for my mother or grandmother in their facility, or someone who runs a senior center. I want this in my facility. What's your message to them?
Yeah, I think the message is going to be that no matter where a person is living, whether it's at home or a senior group living facility, whether they have family caregivers or a home care provider coming in to provide the care, you still need to know what's happening to that individual when there's nobody around to keep an eye on them. Yeah. And so you need this technology. You need to be able to predict and prevent. And if you're a healthcare system, what better way do you have of knowing exactly what's going on and being able to predict and prevent, rather than to react to an event that's happening because somebody showed up at an ER without your knowledge. It goes across the board. And I think the big message is going to be across all of these people, at least in this US, no matter where we are aging, the underlying payers are going to be Medicare and Medicare Advantage. Mm-hmm. And as the shift happens to value-based care, we personify value-based care because it's all about predicting and preventing. And that's the whole crux of it. And so this could very well be the technology that enables value-based care for aging, no matter where that individual is and whatever care setting they're in.
Who are you hoping to partner with in terms of investors and institutional partners? What's your message to them?
So we're really looking for this Series B more for medtech and life science investors who understand the healthcare market and who understand the payer dynamics. We're looking to partner especially with some of the really innovative Medicare Advantage companies that are coming to the table these days. They're all over the country now, like Alignment, Devoted, and many others, as well as the big players like Humana and their Medicare Advantage play, and Optum and United Health. Those are the kind of people that we want to partner with and players we want to partner with, so that we can bring to their large membership the advantages of having this level of insights and the ability to predict and prevent.
Awesome. All right, last question. What are you most excited about that we should be looking forward to from CarePredict end of 2021 and coming into 2022?
I think we have a couple of really good things in our roadmap that are coming up where there's going to be more and more clinical crossover of our product towards the holy grail of unsupervised clinical assessments that are automatically being done by our product multiple times during the day and not at fixed points like they are in the current healthcare world. Those new metrics are coming, those new models are coming, and those are going to be a complete paradigm shift for the healthcare industry as a whole, because now you have a continuously observed person who's going through an assessment at every moment about their functional state or what have you, not just when a healthcare professional comes and does an assessment in a contrived lab type environment. This would be something measuring you throughout. This is quantified self-taken to the next level.
It's awesome. It's exciting. It's something that I want to see for my grandmother, and I can't wait to see what you guys do next. So Satish, thank you so much for taking the time with me today.
Logan, always a pleasure, and thank you for giving me this opportunity to speak with you again.
All right, be well.
Thank you. You as well. Take care.
In this senior living community enabled with CarePredict technology, residents go about their daily lives feeling safe. They know the staff will be there for them should any emergency occur. But the thing is, ever since the CarePredict system was installed, emergencies don't happen that often. At the slightest sign that something might be off, minor changes in someone's unique behavior, like taking longer to walk or waking up often at night, the system alerts the caregivers, allowing them to address whatever's happening before it becomes a significant health issue. Making everybody involved, caregivers and families, feel a lot less worried and a whole lot safer. It's a huge life-improving innovation in a slim device, which is also available for older adults at home and families who want the safety, security, and peace of mind from an ever-vigilant system watching over their loved one. But how does all this magic work? CarePredict has developed and patented a technology platform that uses precise location sensors and sensor-rich wrist-worn wearables to collect the richest and most comprehensive activity and behavior data available anywhere. Advanced kinematics and deep learning algorithms are utilized to accurately observe each elderly person through his or her daily activities, gathering data at every second to identify and chart their individual behavior patterns, so that at any significant deviation, not from the average elderly person's behavior, mind you, but from their own individual daily patterns, the system alerts for a possible sign of trouble when there's still time for relatives or caregivers to intervene. CarePredict exclusive predictive analytics can identify early signs of trouble in a way no other monitoring technology or self-reporting can match. With the amount of data collected about each person's patterns, potentially serious issues like increasing depression risk, urinary tract infections, and increasing fall risk. And it can do that for an elderly member of your family or for whole communities of older adults, continuously 24/7. Making the whole system as sharp and vigilant as no single caregiver, either family-related or professionally hired, could ever manage to be. At CarePredict, we're helping older adults live a longer, healthier, and safer life. We are empowering caregivers to give better, more proactive care, and we are giving families peace of mind.
Quick word about this show, in case you're new around here. At Startup Health, we believe in broadcasting the stories of health moonshot progress, the stories of the most forward-thinking entrepreneurs in health. If you want more of this good news about healthcare's problem solvers, make sure that you subscribe to our channel, hit that notification button, and follow us on social media at Startup Health.